So good morning everyone, and thank you to ZEISS for having me here this morning. I'd like the privilege to speak about the SLT choice for patients with open-angle glaucoma this morning. So just a very brief, quick overview about the evolution of laser glaucoma treatments from 1979, when for the first time ALT appeared in a scientific publication, to go 20 years ago in 1988, when the first SLT publication became available, arriving at 2018, so 20 years later, when the LIGHT study was first published, so the first publication of the LIGHT study appeared in scientific literature. And then up to the 2022, when the NICE guidelines in UK declared and recommended SLT treatment as a first-line therapy to treat people with newly diagnosed glaucoma. So it was an incredible evolution over a couple of decades or slightly more. And that was the year 2022 when ZEISS introduced the technology on Visualase Green platform. So if we look at the main results, the 6-year results of the LIGHT study, we can see that after 6 years of treatment and monitoring, SLT safely offers intraocular pressure control without the need for medical treatment for up to 70% of the patients that were newly diagnosed patients. And also demonstrating another thing, reduced progression rates for those people that were treated with SLT compared with drops, and reduced need over time for glaucoma and cataract surgery. So the ZEISS SLT is based on the so-called photothermolysis effect, resulting in an effective lowering of the intraocular pressure. The short pulses of this technology only interact with the melanin-containing trabecular meshwork cells, leading to an intraocular pressure reduction. So ZEISS SLT can be considered actually as an optional application for the ZEISS Visualase Green Comfort. So it's an optional upgrade of the ZEISS Green platform. And of course, as all the ZEISS devices, it is integrated into the ZEISS ecosystem, providing a high level that are well known to the ZEISS user, levels of flexibility and efficiency. So you can review patients' data prior to the exam and prior to the treatment, clinical data, fundus images, and perimetry. I mean, whatever image and information you collected with other ZEISS devices or have been uploaded on the platform, you can review before starting your treatment. I mean, there have been already some publications about the results obtained with the Visualase SLT. Specifically, this belongs to a publication of a multi-center observational study where involved 5 sites and 33 eyes, where the laser treatment was used as an adjunctive treatment to the medications of these patients. So this was not used as a primary procedure in those patients in these particular studies. They were applied 100 non-overlapping spots over 360 degrees in trabecular meshwork, and the length of follow-up was 3 months. And the results were comparable with that and those of classic SLT studies. You see the absolute pressure at baseline was on average on 21 millimeters of mercury, and the treatment allowed to reduce the pressure in terms of absolute intraocular pressure to 17.5, which corresponded to a relative reduction of almost slightly more than 16%. But it's interesting to note that almost half of the population of this study benefit from an intraocular pressure reduction equal or greater than 20% from baseline. That is what we tell our patients to expect after an SLT treatment. So, as I told before, the technology and the process The tissue process of this technology involves this photothermolysis effect, and where the pulses of the lasers are very short, and this simplifies a lot the titration process. You have a rotating ME beam that allows you to look at the trabecular meshwork where you are delivering the laser treatment, rather than having a bright red spot that is covering almost the area that you want to treat. And the square spot shape also ensure high homogeneity of the laser energy distribution compared to a round spot shape that typically equip the SLT platforms. This is just a side-by-side comparison of the ZEISS SLT compared to conventional SLTs, so I highlighted in red just the rows where the main differences occur. So the arrangement of SLT applications is very different, because conventional SLT deliver one single spot when you push the button or the pedal, while here you have a pattern of 52 single little spots that durate for 200 nanoseconds compared to the 3 nanoseconds of the conventional single spot. And another important thing that I just mentioned before is the way you can titrate your power according to the different pigmentations of the angle. You know that with conventional SLTs, you always have to adjust the energy according to the pigmentation of the trabecular meshwork in order not to see the bubbles. But in this case, with the Visualase SLT, actually you just base your settings that we will see in a while on your laser based on the general pigmentation of the trabecular meshwork. You have broad ranges of powers that you can just set once or twice during the whole 360-degree treatment. So no need to titrate and adjust continuously the knob of the power. Here is the way you should in some way assess the level of pigmentation. This is based on the Sheye shading scale, which is very well known and available everywhere, where you can have mainly three kind of situations, where the pigmentation is known or just visible, so that is the Sheye grade 0, and you use powers between 30 and 40 microjoules. Or if the pigmentation is mild to moderate, so Sheye grade 1 or 2, and you set between 20 and 30 microjoules. And if the pigmentation is marked to intense, like in pigmented glaucoma, for example, you can use very lower settings between 10 and 20. And so the 50 microns optical fiber with a square cross section offers also three main advantages. If any beam shows a square shape, laser is in focus, so you are able to understand whether the laser is in focus or not because of the shape of the beam. Of course, if the shape is round, you are out of focus. You can just really trim your focus by looking at the shape of the beam. And then you have an improved beam profile homogeneity because of the square fiber. And again, you have combined short pull patterns rather than just one big spot, without overlap and gaps possible between the spots. Actually, the rotating ME beam, which is loved by some operators and hated by some others, I am one of the lovers one, actually enable an accurate positioning of the laser and improve visibility of the trabecular meshwork, as I mentioned before. But in the near future will be available in the platform also the option of a fixed ME beam for those that are haters of the rotating one. And the laser application with a total diameter of 400 microns, exactly as the conventional SLT, as I told you before, consisted in 52 little square spots, and the square spot shape ensure higher homogeneity of the delivery of the energy. Another interesting features of this platform is the so-called touch control center that you have just beside your joystick. So you don't have to move your eyes away from the slit lamp when you want to adjust the power of your laser or other parameters. You just, with the right finger of your hand, just click on the touch control panel, and then you will see within the oculars of the slit lamp all the important parameters that you are changing, and you can just keep going with your treatment. This is just an example of a live treatment thanks to the courtesy of my great friend and colleague Matteo Sacchi from Milan, and just to see the rotating ME beam while you perform the treatment. And just to conclude, I would like to share with you some preliminary results of the first 14 patients treated at our institution, VTI Foundation, here in Rome. We enrolled 6 females and 1 male at the beginning, and then the population was increased. So we have 14 cases so far at 3 months. We will publish, hopefully, together with Matteo Sacchi, the 6 months results by September. And the average age of the population was 76 years old. And of these guys where the treatment was used as an add-on treatment to medications, no as a primary treatment, again, as the publication we have just seen before, only one was non-responder to the laser treatment. 57% of the patients achieved at 1 month at least 20% reduction of the intraocular pressure, and this proportion, interestingly enough, increased to 85% of the patients at 3 months. The absolute pressure reduction from a baseline of 22 was 4.6 millimeters of mercury, and at 3 months was 6.7 millimeters of mercury. So it seems that the effectiveness of the laser tends to increase from 1 month to 3 months, as we are expected that the effect of the metabolic activation of the trabecular measured cells take time to occur and to be associated with a positive effect on the intraocular pressure. In terms of average relative pressure reduction, it was reduced by on average 20% at 1 month, and on average, surprisingly enough, to 30% at 3 months. So just few take-home messages. So SLT is now a recommended first-line treatment for open-angle glaucoma in some countries, such as in the UK, and became a very popular option in many other countries, both as a primary option and as an add-on treatment. It is listed as a first-line treatment also in the European Union and in the US, and it could represent a valid additional treatment on top of medical therapy. So the additional advantages of SLT with the visuals offers, first of all, an efficient way of treating POAG as an adjunctive treatment with some particularities that can differ and differentiate this platform to the classical SLT modality that I personally love very much. Thank you very much for your attention.